And our final lecture for Chapter 11. I know there's been a lot of them, but I've tried to keep them short so that it's not 4, 1 hour lectures, which is just too much that I know you won't sit through. When it comes to transmitting person to person, animal to person, person to animal, whatever, to be able to pass it back and forth, person to person, person to animal, animal to person. They call this communicable. It's a communicable disease because it can be passed person to person. You may have a disease where you got a cut, you got an infection, your arm's infected, blah, blah, blah. That is not communicable. I cough, you breathe in, you now have whatever caused me to cough, whatever's in my lungs, whatever's in my sinuses. That's communicable. Communicable, contagious. Tomato, tomato, okay? I always say contagious, but the clinical terminology is communicable. Non-communicable, infected cut. Infected cut has spread up my arm. Sore throat. Okay, I'm not going to give my sore throat to you. Okay, that's not contagious. That's not communicable. If it was a sore throat that we were able to pass back and forth, it was communicable, then that's going to be some type of a viral infection, not what normally causes a sore throat, which is Streptococcus pyogenes. So when you go and you look at these patterns of transmission, we split the ways of transmitting communicable diseases into 2 factions. First faction we refer to as vertical transmission. Vertical transmission only occurs mom to baby, in utero. Okay? When the baby's still in the uterus, developing, fetal development, and all of that, early, late stage fetal development, that is vertical transmission. Has to cross the placenta, has to deal with something that deals with sperm, the egg, there. Some textbooks, some microbiologists, some clinicians even take it a step further and say breastfeeding. If something passed through the breast milk into the baby, that's vertical. Dads, men have nothing to do with vertical. Any women, not the mommy, have nothing to do with vertical. Any person to person, dad to child, child to child, adult to adult, this is referred to as horizontal. Okay? Horizontal can be direct. I shook somebody's hand. I kissed somebody. Somebody sneezed. Achoo. Millions of droplets just came out when they sneezed. The big ones are going to fall within minutes. The microscopic ones are going to hang out there floating 10, 15, 20 minutes. I breathed those in. That's direct, horizontal transmission. Indirect transmission is there's something in between. I picked something up and handed it to you. You touched it. Because I did this, I got whatever was in my nose. The mucus is on my fingers. Whatever viruses are infecting my upper sinuses, my upper respiratory, my sinuses were in the mucus, are now on my fingers, are now on this. I just handed it to you. You touched it. You did that on your nose too. Or you touched your face afterwards. Indirect. There's something in between. They call these, there can be, fomites. You pick up a toy, somebody else, some kid, some toddler drooled all over, whatever was in their drools, now on your hand, you're going to touch your face, there you go. There's also vehicles, water, soil, food. And then there's vector, mechanical vector. Insect carries something on them. Bot flies is an infection with bot flies. There's one. The fly gets eggs on them. or I'm sorry, the mosquito gets the eggs on them. They land, the eggs fall off onto your skin, larvae come out, the parasitic larvae then burrow into your skin. Mechanical. Or the fly lands on the poo, lays its eggs, flies off. On it, the end of its legs, it's going to have microscopic particles of feces. It's then going to land on your plate, walk across your food, leaving behind microscopic particles of some animal, some person's poo. Biological. Mosquito comes in for a blood meal. When it comes in for a blood meal, it injects its proboscis into your skin, and then it immediately spits out some saliva. In the mosquito saliva are anticoagulants. Keeps the blood from coagulating. Keeps it from clotting up. So it, blood will flow so it can drink. Within the mosquito spit are going to be whatever, viruses or microscopic parasites if you're talking Plasmodium. I think it's the trophozoite phase, but it's been a while since I lectured Plasmodium life cycle, so don't quote me on that one yet. When we get to the circulatory infections, diseases chapter, then we can talk about that. So, another great source of infections is going to be the hospital itself. Yes, since Holmes, Semmelweis, Lister's time in the mid to late 1800s, hospitals have made great leaps and bounds in cleaning themselves up, in minimizing patient spread of disease, doctor, nurses spread of disease. But they're not perfect. Diseases that are spread in the hospital get their own special characterization, their own special grouping. They call this nosocomial infections, hospital-acquired infections. You show up at the hospital for one thing, and while you're there, you get something else. Pneumonia, surgical site infection, gastrointestinal illness, means somebody didn't wash their hands as they're handling your food, or they're touching the drugs you have to take. Urinary tract infections is also a big one. A lot of patients, because they are not going to be mobile or they're going to be incontinent during their surgery and recovery period, they will insert a catheter. Male or female, they'll insert the catheter up the urethra. Thing is, as they're going to insert the catheter, it may touch the glands of the penis. It may touch the folds of the vulva. When it touches, it picks up hundreds, if not thousands, of bacteria. Whatever bacteria are at the terminal end of the urethra, they can't quite ascend because the patient's been peeing and the flushing action, keeping them out. But hey, that catheter going up is going to pick them up, and it's going to push them up through the urethra. Maybe up high enough into the bladder.